Hello, my name is Annie Breaker, and I'm currently a senior at UNC Chapel Hill studying psychology and human development and family science. I have been working part time at a child care center in Chapel Hill for about 10 months and interning for Child Care Services Association, or CCSA, for a few months as well.
CCSA is a nonprofit organization in Durham, North Carolina that administers Durham Pre-K, Durham County's local investment in preschool expansion. CCSA collaborates with Durham's Partnership for Children, Families and Communities Rising, and Durham Public Schools to blend local and public funding and increase access to preschool for Durham's 4-year-olds.
For as long as I can remember, I have been passionate about supporting children through their development, and I have found that one of my greatest passions is advocating for accessible, high quality early childhood education for as many children as possible.
I believe that accessible and high-quality early childhood education has the potential to mitigate many inequalities and disparities in schooling, careers, and other aspects of our society. Even during my limited experience as a preschool floater, I have witnessed highs and lows and everything in between. I have seen children struggle with inconsistency in teachers and routines, which impacts their ability to learn. Consistency and routine is incredibly important for young children, but the unfortunate reality is that early childhood educators are overworked and underpaid and often don't stick around long enough to provide that consistency. Funding for early childhood education should be a priority. The younger children can begin to receive similar opportunities and start with a similar level of knowledge, the more they will have opportunities to succeed throughout their schooling, their future careers, and the rest of their lives. Early childhood is a crucial time for children to begin learning the basic skills they need to succeed, and increased funding and resources must be prioritized for a more equitable future for everyone. Making high quality early childhood education accessible to all children would make a significant difference in the lives of individual children, communities as a whole, and our entire future.
My experience in the field is limited, so let's hear from some individuals with more experience in early childhood education.
I asked Linda Chappelle, the Senior Vice President of CCSA, Beverly Williams, the Technical Assistance Manager at CCSA, and Kate Elander, the Early Childhood Coordinator for Durham County Government, what challenges they have seen in the early childhood education field due to a lack of resources, funding, or accessibility.
We are really challenged by the lack of interest in early education in the workforce, which stems from long-standing underinvestment in early education as a career. The wages in early education are notoriously low, and in some parts of North Carolina, early education teachers don't make a living wage. And the problem with that is that when you have long-term underinvestments in a field, then the consequences obviously are that it's going to lead to shortages.
There have always been just a lot of challenges, but since COVID, we are really seeing the impact of teacher pay. I mean, working with children is always an underfunded situation. And since COVID, teachers are really leaving or not coming into the field because of lack of pay.
It's important to acknowledge that turnover in caregivers and teachers in childcare settings really impacts child development. Children need to form secure attachments to their caregivers, and when it's sort of like a rotating set of people, or they lose a caregiver because someone has left, either to go somewhere else where they can make more money or to leave the field altogether. It's harmful.
Teacher turnover is a major issue in early childhood education, and this turnover can negatively impact children because forming attachment over time is especially crucial for infants and toddlers due to their developmental stage. The data presented in this table comes from 2015 and 2019 director and teacher surveys and is included in the 2019 workforce study on working in early child care and education in North Carolina. This data is pre-pandemic, but it is the most recent data available at the moment. The workforce has been particularly unstable during the past few years due to the effects of COVID-19, and many of the issues faced in the early childhood education field have been exacerbated by the pandemic. Post-pandemic data is currently in the process of being collected, but has not yet been finalized. The percentage of full-time teachers and assistant teachers who reported leaving their centers in the past 12 months increased from 2015 to 2019, going from 19% to 22% for teachers and from 13% to 18% for assistant teachers. Addressing the pressing issue of teacher turnover in the field is important for the healthy development of children. Based on data from the 2019 workforce study, both teachers and assistant teachers reported better pay as the #1 factor motivating teaching staff in North Carolina early childhood programs to stay in the field, with 81% of each reporting this as the top motivating factor. Better benefits was the second most reported factor motivating teachers to stay in the field, with around 55% of teachers selecting this as a major motivator. How would an increase in funding, teacher pay, accessibility, and/or resources impact the lives and development of children?
Research shows us that high quality early education makes a difference in a child's development, in their long term success, in their readiness for school, and their long term success in school. That foundation from birth to 5 is so critical, but yet we are underinvest in the early care for young children. And many of our teachers and our instructional assistants are under credentialed in early education because of the wages. And sometimes the developmentally appropriate practices and research based strategies don't make it into the everyday lives of our youngest children. And so the quality may not be there. And then you have families who want the best for their children, but they're oftentimes picking childcare based on what they can afford. And that may not be the same as what they would pick if they were able to pick based on high quality.
If we have a fully qualified, educated workforce, they are now putting that into the children. And that will help serve a better experience for the children. I mean, the children that we're working with from birth to kindergarten, we're the foundation. So I need to make sure my children have a good start. So when they go to kindergarten, they can make those EOGs at the 3rd and 6th and 9th grade and graduate.
It's well documented that when parents and caregivers are stressed, children are also stressed. And so by investing in childcare and directly in early childhood educators, we are investing in reducing stress for parents because they have access to reliable and safe and affirming childcare settings for their children so that they can work or pursue other goals that they have for their family. And that pay and investment in early childhood educators directly impacts their ability to be present and warm and supportive in their care and education for young children. So it's a stress reducer for everyone.
We know from the research that those first few years of a child's life are really all about their brain development. And we know from the research that it makes a difference what their quality experiences are. And so by investing in all the supports needed to provide quality, what we are doing is we're investing in the long term in the life of that child. So it's not just about kindergarten readiness. It's about foundational knowledge, foundational developmentally appropriate practices that are going to support them. So you're going to support children by having good, positive social emotional development. It's not just about them being ready to learn math concepts or, have a good foundation for literacy. It's also about, do they play well with others? Can they? Can they navigate all the stressors that happen in life and building those building blocks for being able to think critically, being able to make friends, being able to in social settings communicate positively. Those experiences that children have really impact the way that they're able to navigate the world in the future.
I asked the same three individuals, along with Michelle Miller Cox, the executive director at First Presbyterian Day School, what they want at the forefront of policymakers' minds regarding early childhood education.
Funding to support accessible, affordable health benefits or health and medical, dental, vision, just, an entire package around health. I'd like that to be at the forefront of their minds because it's just not always just the money. I mean, some people would take a pay cut to go somewhere that has benefits. And to help navigate that with funding would be huge. It would be huge. I mean, that would help sustain the staff and the teachers. You don't have as much teacher turnover. People will tell you, yeah, I'm gonna go over there because they're offering benefits. So we're going to lose them to the public school systems if we don't do something because they're going to get benefits. Their pay might not be that great, but when you start reaching a certain age, you got to have those resources in place.
Data from 2015 and 2019 director surveys reveals the percentage of programs in North Carolina that provide various employment benefits. 49% of programs in 2015 and 48% in 2015 provided at least some help with health insurance. The percentage of programs providing fully paid health insurance, however, dropped from 19% in 2015 to 15% in 2019. Increasing the health benefits provided by centers would help to keep more individuals in the field and prevent teacher turnover, and would help bring more people into the field.
The first step in investing in our early education system is really to take a hard look at what are the resources available to pay adequate wages for teachers and instructional assistants in classrooms. That's just a critical piece. And families cannot bear the cost of what you have to charge in order to then have robust salaries for our early educators. And therefore, investments should come not only in workforce strategies and wage support strategies, but also in investments that will allow families to only pay all families to only pay part of the cost for early education.
If we're putting all of our funding here at the beginning and giving the children a great foundation, hopefully we don't have to spend money when they deter and go down the wrong path. So it may cost us a little bit more at the beginning, but I think the payoff at the end will be worth it.
In order to best respect and care for young children, we have to invest in the people educating them. We have to invest in the settings where they're learning and growing. And we're certainly not doing that enough right now.
Some main takeaways from the interviewees' responses are that stress among teachers and parents transfers to children. Investing in children at an early age will help set a foundation and likely lead to less investments later on, and staff turnover and inconsistency negatively impact children. In addition, increasing teacher pay, along with offering a total compensation package including health benefits, will increase quality of learning for children and help maintain consistency in staff and bring people into the field. Accessible, high-quality early childhood education must be prioritized. Invest in our young children. Invest in our future.